Let's talk a little bit about skin. One of the things you do and one of the things you practice a lot, and it's not just for skin and for anti-aging or, cosmetic, but there's a lot of stem cell peptides, exosomes, things of that nature that are in your practice. And I actually forgot to mention this in our sort of sexual health conversation, but there's like the O shot and things like that. Mm-hmm. Talk a little bit about the role of peptides. And we can talk about bioregulators, we can talk about longer chain peptides in the role of anti-aging.
Yeah, I think that, there are several great peptides for skin. Certainly GHK copper, for instance, is one that you can apply topically. It's in a lot of the lotions and potions that are out there now. You can get cosmetic products with it in there. We used to be able to use it as an injectable as well. It has a lot of other benefits besides skin. Certainly in the last few months, the FDA has cracked down on us being able to prescribe peptides, except for there's a couple of oral ones and a couple of topical ones we can still use, but we can't use injectables. But, there are other peptides like L-arginine is another one for skin that's a topical that's great. BPC 157, which is tends to be thought of for healing musculoskeletal pain, and for gut health is also really good for skin. So there's a lot of peptides, and then I do a lot of skin stem cell procedures for skin as well as for hair restoration, injecting stem cells and or exosomes into the skin, and then microneedling as well and applying them topically. So I use a lot of those type of biologics as well.
So talk a little bit about what's the mechanism for the stem cell? What type of stem cell are you ingesting or injecting, I should say? There's different categories. There's like mesenchymal or stromal, I guess, and then there's maybe embryonic. I don't know if those are even used anymore.
We don't use embryonic.
Yeah.
So we use mesenchymal stem cells. So these are also called MSCs. Some people consider them more like signaling molecules than actual stem cells, but essentially these are cells that are in all tissues in your body. And we can either take the stem cells from the patient, like we can get a little bit of bone marrow or a little bit of fat and get your own stem cells and then put them either in your skin or your scalp or your sexual organs or your joints or wherever. Or we can also use stem cells that are in like placental or umbilical products that are donated. So these are like full-term babies. And then instead of throwing away the placenta and the cord, they donate those tissues to a lab and they get processed and they get screened and all of that. And you can use some of those tissues they'll have like the exosomes, which are like extracellular vesicles, like the signaling molecules. And they'll have like Wharton's jelly, which is like hyaluronic acid, which is good for skin also, as well as stem cells. So there's various pieces, but the way all of it works is pretty simple, which is that when you, like for instance, for skin, if you're injecting these things, the stem cells or exosomes, they send out signals to the cells that you already have in that area, like your own skin cells. And it tells your cells to become more active. So you get increased blood flow, you get increased collagen and elastin and hyaluronic acid formation. So it kind of takes these cells that are in your body that are kind of in a more resting state, and it tells them to become more youthful cells. So that's how all of these regenerative therapies work.
And how often, how many stem cells are required in order to affect change? What is the frequency with which you need to be engaging in this? And
all good questions and things that we don't really know. I mean, there haven't even been head-to-head studies with like, if I use your stem cells versus umbilical cord stem cells for skin rejuvenation, which one's better? Like we have studies that show your cells are helpful. We have other studies that show stem cells from placentas are helpful, but there haven't been any head-to-head studies, and there aren't a lot of big studies for sure. These are mostly kind of small studies. They seem to all do the same kinds of things in terms of the ways, the signals they send out, but we don't know the dose necessarily. We just kind of are estimating. Most people will do them no more than once a year, depending on, maybe exosomes more frequently because they're less expensive and a little easier to do. But, stem cells, they're pretty expensive still. And so most people are not going to do them more than once a year. Sometimes it's, every few years.
And what is is there a general range in terms of pricing? Like when we say very expensive?
Yeah, I mean, it really depends on how much product you're using and how good the product is and where you're getting it from. It could be, for exosomes, I've seen as low as like maybe $1,000 for a treatment, but that can go up to, $5,000 or $6,000 or even more, because the cells themselves and the exosomes themselves are pretty expensive. So the procedure is easy. It's not a big deal, but the tissue products are pricey still. I think they'll get better, but yeah, they're still expensive. The good ones are still expensive. You can get ones that are not very good for less, but the good ones are still expensive.
Yeah, and it's really the sourcing of the product that's more important.
Yeah.
Yeah. What are your thoughts on Botox? I had Tony on the show.
Oh, yeah.
I guess it was a couple months ago now. A good friend of mine, known him for years, Tony Yoon. He said something that I thought was really interesting, which was Botox is the most used, how did he say it? It's the most used product or beauty product, I guess, in the history of the world.
Wow.
Yeah, like ever, like from the beginning of time.
Does that include what is a beauty product? Like lipstick? Is that a beauty product? I feel like
that's a great question. But I guess an intervention, maybe an injectable.
Okay. Yeah.
And he was very bullish on the safety profile. Like there's very low risk. Maybe you have, if the injector or if it's put in the wrong area, you can get like, if, you're doing it in the forehead, maybe you can have like droopy eyes, that kind of thing.
Yeah.
But then that resolves itself eventually because it doesn't stay. What are your thoughts on Botox as an anti-aging tool? And then I have a comment that I recently heard from another practitioner that I'll share with you. I'll share it with you now. His concern was when we are over Botoxing. So if you are Botoxing for years and years and years and years, I mean, what it's doing is essentially paralyzing the muscle so that the muscle's not being used. So of course, over, the trajectory of that, when you sort of pull it out over decades, is that now you're going to have atrophy of the muscle. Like if you're never able to use your forehead muscle, then that forehead muscle eventually is going to atrophy. So then you're sort of stuck in this, I have to do it forever, or, that loss of volume that can occur with time will necessitate other interventions. Maybe it's, I don't know if you do filler in the forehead, but other things. So with all that context, I'm just hearing a couple different things because in the spirit of transparency, I'm 46. I'm like, all right, maybe I need to kind of start working on this. Like maybe I need to start prophylactically working on this. So I'm also asking selfishly for myself as well, for all of you experts who are doing it all the time. So
Yeah.
what is your thinking around, and I know this is like my Betties, my audience also is like, we're all vain. We all want to look our best. So tell us, is Botox something that we should consider? Is there a real concern around atrophy of the muscle over the long term?
I think I'm probably in Tony's camp. I think that there are a lot of uses for Botox and other toxins, other neurotoxins. There's the ZMN and Dysport and all those other brands. They've been used now for 20 years or something, and we really haven't seen. Obviously that's only 20 years. Maybe there's something at 40 years that happens, but we haven't seen a lot of side effects. And I think that it can be really helpful. I don't think that everyone needs it. I don't think if you don't want it, that's great. I think you could be beautiful either way. But I do think that it's very, very safe. Botox has it's only ever been a problem, like a serious problem in super, super high doses when they're treating muscle spasms and people who have paralysis and things like that. Like when you're doing normal facial treatments, no one has ever gotten seriously injured from Botox. Yes, you can have a droopy eye for, weeks to months, but it's maybe 2% of the time that happens. It's not very common and it always goes away. So from a safety profile, I think it's great. You could argue on whether it looks good or not. I think it depends on your injector. Some injectors are better than others for sure.
Yeah.
To the atrophy thing, it's an interesting point. I haven't seen it. I'm not saying it's not possible, but the places that we're injecting, another school of thought is it'd be great for those muscles to atrophy because then they wouldn't be contracting and causing your skin to wrinkle.
Right.
I'd be happy if my forehead muscles were not as strong because then they wouldn't be wrinkling as much. And the muscles that we're injecting are mostly it's forehead, around the eyes, for instance. Those muscles they're not like these big, thick muscles like they are in your cheeks and places like that. So I don't know.
But you're still going to be able to chew. Like we're not paralyzing the masseter or anything like that.
You don't inject. In general, you don't inject much, but from here down, like the cheeks down, you can do little bits here and there, but you don't want to hit the big muscles because that'll make your facial expression. You'll have crazy smiles and all kinds of problems. So you really are just injecting the very thin muscles of the forehead and around the eye. So I don't know if atrophy, even if it happened, I'm not sure we'd notice it, but it's a good question.
Yeah. Something that'll certainly play out. And then maybe and then if there is atrophy, maybe you can compensate with things like filler or maybe there's, at that point, maybe the stem cells, you can inject stem cells to help with, my understanding of stem cells anyway, is that we're going to be driving up collagen and elastin production anyway, which is something that, we start to lose volume in the face. Like typically it's the lower half of the face, right? We start to lose volume, like kind of in the, we sort of get like maybe the jowls forming a little bit, and there's a little bit of this hollow, sallow, maybe lower half of the face with time. But hopefully with, studies and enough clinicians like yourself who are dealing with stem cells and peptides and bioregulators and all the things, with time we can figure out maybe it's a stem cell solution. Like maybe it's something that we can rectify with stem cell injections.
Yeah, I think there's a place. I mean, right now I have a lot of patients, some patients don't want to do anything unnatural. They don't want to do Botox, they don't want to do fillers. They just want to do stem cells or fat grafts. Then I have some patients that want to do all the things. And I think that I do think they all complement each other. You can do a laser, you can do fillers, Botox, and stem cells, and they all do different things that are all going to be additive to each other. So I think that that's completely fine. But I also understand that people who, don't want to do those things. And I respect that decision as well.
Yeah, I was saying to Tony when he was on the show that there's a couple of people sort of in, our colleagues that are like, it rewires the neural patterning in the brain. Like if you're taking Botox, for example, it's going to totally rewire. You're going to actually get more wrinkles because there's certain muscles that are paralyzed. You're going to get these sort of like dendritic. You're going to get these little branches of nerves that are coming out like to try and move the muscle. So over time, you're actually going to create more nervous input that you still need to overcome. And so there's I think I'm pretty neutral on it. Like I'm like, well, if it makes you feel good, like you do you, boo. Like if you feel good doing it, you should have access to it. And if you don't want to do it, then that's also your choice. I think like any medical intervention, it's a personal decision and you can just make your own choice. You don't have to declare it to the world. Yeah. But it's interesting how people can get very hot about it.
They can. And I think that, again, we'll know more. It's been a number of years, but we'll know more as time goes on. I think that sometimes people get hung up on like little mechanistic data. Like you can look at something in a petri dish and say that, Botox does this to a cell or a nerve or something. And then you extrapolate that and say, well, if this happens like this, then we put it in people, then the person's going to have this. But we haven't, there definitely are not any studies in actual people, clinical studies that have shown these problems. Not that it's not possible, but it's one thing to see some kind of effect, positive or negative, in a petri dish or in even an animal model. It's a whole other thing to see it in a population of people.
Yeah. What is your thoughts on, I don't want to call it face yoga, but there's someone that I follow online. I love what she teaches you how to sort of massage so for the eyebrows, let's say it's like you're massaging the eyebrow on the sort of the front and on the side, and like how to sort of get rid of nasolabial folds, etc. What is your, I guess face massage would be inappropriate.
Yeah. I don't know that I have a lot of thoughts. I think that there's probably some benefits to like at least some of the drainage pieces of it, the lymphatic drainage and getting the extra fluid out of the face. There's definitely no downsides to it, and it probably feels pretty good. So I think I don't know enough about the benefits, but I think it sounds like a relaxing way to spend a few minutes.
Okay.